70s, where essentially there was an argument that state needs to pull back, the market needed to provide people's social needs, for people's social needs and social goods. However, and this is where the battle of ideas come in, if you actually look at ANC policy, it talks to universal primary education, it talks to a national statutory social insurance arrangements, it talks to, and of course, most importantly, the national health insurance proposals, which are about universal access, and the main source of revenue being an NHA fund, which will be tax-based, okay? Now, these are all the key attributes of a social democratic set of policies. So there's a policy schizophrenia in the ANC. On the one level, it's talking about its developmental state and privileging economism. On the other level, in terms of the substance of social policy, it's completely about a social democratic approach, which is about universalization of social provision, universalization of public goods, based on cross-class social solidarity. And I think that's where we need to locate ourselves in terms of these battle of ideas. Now, I think what's quite important is to also understand that that embedded in South African history, in the policy history, is deeply embedded is this idea of a national health service, and one that is universal, and that one is which is state provided. And I think the starting point for me is to look at, for example, the Gluckman Commission of 1942 to 1944, perhaps the most radical set of proposals that ever emerged about healthcare reform in South Africa. And in fact, I would say that is the most radical form of proposals that emerged. Essentially, Gluckman was sat in the 1940s. It was a committee of the split of the Smuts government of the time, but was led by a radical progressive called Henry Gluckman. And what his vision was to establish a national health service in South Africa that would be non-racial, that would be democratic, and that would be based on preventative health care. And in this, his prognosis of the problems of South African healthcare was that the mere provision of mere doctoring would not provide more health. So essentially, he was pushing for a preventative healthcare model. He talked to the problems of South African healthcare being a spectacle of divided control, poor coordination, overlapping and maldistribution, and gaps, and a crazy patchwork of provision. We know this because this is very similar to what we have currently. And he also talked to the proper integration and coordination of the various health services would be better achieved if the services were nationally planned and directed. So essentially, Gluckman was arguing that if you want to achieve a national health service in South Africa, if you want to have provision for all citizens in the country, you needed to nationalize the healthcare services. And that would needed to be based on the surrendering of the provinces of their control of the healthcare services. So the state needed to take control of the healthcare services, and the delivery of the health services would be decentralized into 20 regions and be based on 400 preventative health centers. And he was very influenced by the work of Sidney Clark, who developed the Polela experiment, the preventative healthcare model. And crucial, he said that it would be based on essentially funded health tax, and the principle is kind of epitome of a social democratic approach, which is said that healthcare should be funded on an equitable basis from each in proportion to his means, instead of inequitable from each according to the degree of his ill health. And this is proposals that emerged between 42 and 44. Okay? And what's crucial as well is also to indicate the historical support for these proposals. You found, for example, the civil society groups, including the trade unions, the political parties, the ANC, the Communist Party of South Africa, were fully supportive of the Gluckman proposals. And I think it's important to reflect on what the Medical Association of South Africa were willing to say about these proposals. They said, we are prepared on our own initiative to surrender some of our independence and to become, to some extent, a socialized profession. So the Medical Association of South Africa in the 40s was saying, yes, we're prepared to be socialized. In fact, we prefer to be socialized. But we know that in terms of where the country is politically, what we need to establish is a nationalized healthcare service. So this is the depth at which there was the support for a